Speech therapy enhances alternative communication methods. Work on other communication strategies to aid communication, such as gestures, sign language, approximations, vocalizations, and/or other means of communication. Hare Krishna WH Care Services mission provides infants, children, teens, and adults with speech and hearing help. Who is speech therapy for? Speech therapy is the evaluation and treatment of communication disorders. A patient's challenges may include speaking, listening, or cognition. Speech therapists can also treat individuals who struggle with swallowing. A speech therapy program is for anyone experiencing challenges with these essential human functions. Speech-language pathologists are trained to restore their clients' capabilities. They can assist with a variety of specific needs. A speech therapy plan is tailored to the individual patient and might include voice techniques, word finding, articulation, cognition, repetition, swallowing techniques, repetition, reading, speech development, language development, problem solving, sign language, and other personalized services. Speech therapy for adults may be necessary after an illness or accident. Dementia, oral cancers, and brain injuries can require support from a speech pathologist. Children with developmental delays or impaired hearing often work with speech pathologists. There is also speech therapy for kids with autism, weak oral muscles, and articulation problems. This is an incomplete list of examples. There are many other reasons why a person might need speech therapy. If you or someone you love needs treatment, let's take a look at why in-home programs are the best option. Your home is a safe space. Home is where we feel most at ease, and it is well documented that we learn best in comfortable spaces. Your house is a safe space where interacting with a new person, your speech therapist, will be as stress-free as possible. In a home setting, therapy patients can relax and focus on what they are learning. There is no adjustment period or uncomfortable furniture to endure. It's easy to take a break for medication, snacks, or restroom usage. Working with a therapist in your own home can also boost the therapy recipient's confidence. Entering an unfamiliar space is scary for children and some adults, especially if they are recovering from a traumatic illness or accident. Eliminating that fear is simple with in-home sessions. Caregiver participation improves outcomes. In-home speech therapy makes it possible for parents, caregivers, and siblings to participate in the therapeutic process. Observing the therapist at work is a great way to learn techniques that can help your loved one. Your speech pathologist is only present for a few hours a week, but the therapy doesn't have to stop there. Other members of the household can provide care continuity by taking tips from the therapist for daily coaching and practice. Research shows that caregiver involvement leads to better outcomes, so it makes sense to involve as many loved ones as possible during therapy sessions. Familiar routines reinforce progress. Why apply speech therapy lessons in an unfamiliar setting when they could be specific to your everyday routine? In-home visits allow speech therapists to customize the experience to suit the patient's regular habits. Therapy sessions centered around meals, bathing, or diaper changes are highly relevant and more useful than office-based sessions. At home, the client can practice navigating situations they will face every single day. Personally relevant therapy works best. Personally relevant items can also support effective therapy sessions. Your house is full of meaningful photo albums and belongings that can stimulate memories and conversation. It can be difficult to achieve a similar result in a therapy office. Additionally, if your therapist provides swallowing services, you can practice with the silverware you actually use. There's no commute necessary. Often, speech therapy patients have just returned home from a hospital stay. The thought of visiting another medical office can be overwhelming. In-home therapy gets rid of that stress. It can also be difficult to arrange transportation for seniors who no longer drive. Taxis are expensive and family members have full schedules. For busy parents with children, traveling to and from appointments is a time-consuming hassle. Opening the front door for your therapist is an easier option. You'll maximize your session time. Visiting an office for speech therapy sessions means sitting in a waiting room. Time spent waiting to be called in can cut your therapy program short. When your therapist arrives at your house, you can get started right away. There's no waiting around for the receptionist to check you in and lead you to your therapy space. In-home therapy reduces stress and fatigue. Perhaps most importantly, in-home speech therapy is the least stressful situation for patients. You might not realize how draining medical office visits can be for both children and adults. Traveling to and from appointments is physically exhausting for an ill or recovering patient. Adapting to an unfamiliar space requires effort. At home, the therapy recipient can focus their full energy on making beneficial progress. Choose in-home speech therapy for success. Now that you know more about the benefits of in-home speech therapy, scheduling your first appointment should be a no-brainer. Give yourself or your loved one the gift of a stress-free therapy experience. By avoiding office visits, you'll achieve faster, better results from your sessions. There's no need to get in your car or call a taxi. Just sit back, relax, and wait for the doorbell to ring.